Smith, now that we're done with your physical assessment, I'd like to go ahead and discuss my findings with you. Given that your symptoms began suddenly today with that pain around your belly button, and then it moved over to that lower right side of your stomach, it's tender when I touch there, you say that it's worse when you take a deep breath or when you sneeze, I'm growing a little suspicious for appendicitis. What appendicitis is inflammation, possibly an infection, in your appendix, which is actually just this very small pouch located at the very base of your large intestine at the end of it, and that's actually located in that right lower portion of your stomach. I have a picture here to kind of show you. So the pink loop that kind of goes all the way around, that's your large intestine, and there at the very bottom, that little white area is your appendix. So there's actually no known function for the appendix when you're an adult, but it can become blocked by stool, parasites, other foreign substances, and this can cause bacteria to build up, and what eventually can happen is that the appendix will actually burst and the contents will release into the abdomen, and this can lead to a very serious and life-threatening infection. Because of the blockage, you get that swelling to the area, and that's why there's pain there. So this could explain why you're having pain here in that right lower portion. Could also help explain why you're having the nausea, the vomiting, the trouble with passing bowel movements, the bloating feeling that you've been having, and the low-grade fever that you presented here today with. When I push in that lower portion of your stomach and the pain feels worse when I relieve the pressure off, this is actually called rebound tenderness, and it's one of the hallmark signs of appendicitis, so it's helping grow my suspicion a bit further for this diagnosis. Around 1 in 1,000 people in the United States are actually diagnosed with appendicitis every year. They're usually between the ages of 10 and 30, and globally it's around 100 to 100 per 100,000 people, so it's pretty common. Usually males have a higher risk for appendicitis in comparison to females, and given that you're a 20-year-old male, so you fall in that age bracket and that gender bracket, pretty much puts you right at these statistics. Some other factors that are said to increase one's risk are a family history of appendicitis, again being a male, kids with diagnoses such as cystic fibrosis have a higher risk. So those are just a few things that kind of put people at a higher risk for this, but it truly can affect anyone. Today I'd like to go ahead and get a urine sample and some blood work. And what the urine sample will help me rule out is just if there's a urinary tract infection that could help explain your pain and the other symptoms that you're having. And the blood work will show me if your white blood cell count is elevated. So white blood cells respond to infection, so if it's elevated, that'll kind of help me solidify and be more suspicious and make me order that stat CT scan of your abdomen so we can get a greater look. So if your white blood cells are elevated, the pain is increasing, we're gonna go ahead and get that CT, and what that is you'll just lie on this table, they'll take some radiographic images by injecting some dye into your IV, and the dye will go through your vessels, and that'll kind of light up that area of inflammation, and then it'll confirm our diagnoses here. It could also help us rule out some other things that this could potentially be, such as diverticulitis, cecal volvulus, could even be testicular torsion. We would have to get an ultrasound for that. Some foods that could potentially reduce the risk for appendicitis would be fiber-rich foods such as oats, wheat, and fruit, and those are usually recommended. But if the diagnosis is made and it is confirmed with the CT scan, the treatment option here would be an appendectomy. So this is the actual surgical removal of your appendix. And I know that sounds scary, but about 250,000 of these are performed yearly. Most of them are actually done laparoscopically, which are just small, tiny incisions made into the abdomen, and small cameras are inserted into there, and they just snip the appendix right out, and it's a very, very quick recovery time usually. A completely normal life can be lived without an appendix. A full recovery can be made. Granted, there are some risks here. If it does rupture, we'll have to get some antibiotics on board, and we could be looking at a potential infection, but I don't think we're there just yet. I'm going to go ahead and make those arrangements for you to get over to the ER. Can I answer any questions for you today? All right, well, thank you so much for allowing me to participate in your care, and I hope you feel better soon.